The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and thanks to everyone for listening in. Today's topic is the 2027 Medicare Advantage Advance Notice is here, and MA just got hit hard. If you work anywhere near Medicare Advantage, pricing, actuarial, stars, risk adjustment, finance, product, sales, or strategy, this is one of those episodes you need to hear all the way through, because the notice was released and it sent a shockwave through the MA industry. After several brutal years, after a 3-year phase-in of the V28 risk adjustment model, after utilization spikes, drug cost inflation, and margin compression, plans were expecting relief. Instead, they got a near-zero rate increase paired with new risk adjustment policies that hit hardest where the industry has relied most heavily. Today, I want to walk you through what CMS actually proposed, why the rate increase is so low, how risk adjustment changes did most of the damage, and what this tells us about where Medicare Advantage is heading. This is not just a rate story, it's a direction of travel story. So let's get right into it. We'll take our normal 3 breaks to divide this up a bit. So let's hit segment 1, the shock and why expectations were high. CMS released a 169-page advance notice along with a fact sheet and press release. I've reviewed all of it closely. Here's the headline number. The proposed MA rate increase for 2027 is just 0.09%. That's roughly $700 million in additional MA payments across the entire program. Now let's put that in perspective. In 2026, the MA rate increase translated into roughly $25 billion in additional payments. That delta alone explains why MA stocks dropped immediately, analysts scrambled, and United Health and Humana took the biggest hits given their size and reliance on risk adjustment. This wasn't just disappointing, it blew up 2027 planning assumptions. And those expectations didn't come out of nowhere. MA plans just finished absorbing the 3-year phase-in of the V28 risk adjustment model running from 2024 through 2026. By my calculation, V28 stripped about 7.62% out of MA rates once normalization is included. That alone would have been manageable if nothing else changed. But everything else did change. Coming out of COVID, medical utilization jumped, drug costs accelerated, deferred care came rolling back. On top of that, the Inflation Reduction Act shifted billions in Part D cost sharing to plans. CMS imposed new administrative and compliance requirements, and prior authorization rules increasingly forced MA to mirror fee-for-service processes. So heading into 2027, plans weren't asking for windfalls. They were just looking for a little breathing room. That's not what they got. We're going to take our first quick break, and when we come back, we'll dig into the economics of this all. And I'll explain how CMS took a nearly 5% economic growth rate and drove it down to almost zero. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth Podcast. We're breaking down the 2027 Medicare Advantage and Part D Advance Notice and why it landed so hard on the industry. Let's get to segment 2, the economics, how the growth disappeared. Let's start with the foundation of MA rate setting, the effective growth rate, or EGR. For 2027, CMS estimates the EGR in the advance notice is 4.97%. That's a reasonably strong number. The EGR reflects growth in per capita cost in original Medicare fee-for-service in Medicare Advantage for the non-ESRD population. It's a national estimate, meaning actual impacts vary by county and region. County benchmarks are then adjusted based on where local fee-for-service costs fall, from 95% to 115% of fee-for-service based on the reimbursement law. What's driving this growth? Primarily original Medicare utilization. Even though utilization trends lag in rate setting, the signal is clear. Utilization is robust, costs are rising, and the system is still absorbing post-COVID demand. For context, the 2026 advance notice showed an EGR of 5.93. The 2026 final announcement pushed that to 9.04%. So when you see a 4.9% EGR for 2027, it tells you utilization pressure hasn't gone away. CMS also rebases county fee-for-service rates using 2020 to 2024 claims, uses calendar year 25 as the base year for most service expenditures, and it continues removing MA-related medical education costs from projections. All of that should have supported a meaningful increase at 4.9%. But CMS then layered on 2 major risk adjustment changes that almost completely wiped it out. Let's talk about risk adjustment change number 1, updating the V28 model further. That impact, negative 3.32% with normalization. CMS proposes to update the MA risk adjustment model to reflect more current data. 2023 diagnosis predicting 2024 expenditures, payment year 2024 per capita costs instead of payment year 2020. This is CMS saying, we want the model to keep up with reality. More recent fee-for-service coding patterns are now embedded in the model, reducing the timing advantage MA plans historically had. CMS argues this improves accuracy. Plans argue, with some justification, that this is another haircut layered on top of V28 before margins have had time to recover. With normalization included, again, this change alone reduces the rate increase by 3.32%. Without normalization, it's still 1.82%. Either way, it's substantial. Let's move on to risk adjustment change number 2, reining in unlinked chart reviews. That impact, negative 1.53%. This, in many ways, may be the most consequential proposal in the entire advance notice. CMS proposes to exclude diagnoses from audio-only services and exclude diagnoses from chart reviews and health risk assessments that aren't supported by a medical encounter submission. CMS estimates plans received about $7.5 billion in 2023 from diagnoses that appeared only in risk assessments and related chart reviews, not on encounters. That tells you exactly who this targets. Plans that relied heavily on retrospective chart reviews and manual documentation strategies in standalone HRAs, particularly large national plans, will feel this the most. Put the 2 risk adjustment changes together and they nearly eliminate the EGR. That's how CMS gets to a 0.09% hike. CMS does note an anticipated risk score trend of 2.54%, but plans strongly reject treating that as real rate relief. They argue, and I largely agree, that risk score trends reflect real population acuity, not just gaming. Recent margin compression supports that view. We're going to take our second break now, and when we come back, we'll talk about star ratings, other financial details, and the broader warnings CMS is sending about the future of risk adjustment. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. We hope you are enjoying this edition of the Healthcare Labyrinth Podcast. Let's continue our deep dive into the 2027 Advance Notice. Let's move on to Segment 3, Stars, Other Financials, a Warning Shot, and could there be some relief in the final announcement? On star ratings, the immediate impact for 2027 in rates looks modest. CMS projects an aggregate impact of negative 0.03%. That's largely because star ratings changed little between star year 25 and star year 26. There's a 1-year lag between ratings and payment. But this comm is misleading. CMS is executing a multi-year stars overhaul, fully rolling out in star year 29. Easy operational measures, nearly a quarter of the rating now, are eliminated. Weight shifts heavily to medical, drug, and CAHPS and HOS measures. Medical and drug measures rise to 46% of the rating. Survey measures climb to 39%. The result? Well, it's not good. About 90% of contracts will see a decline in their overall contract rating. Average ratings will drop 0.15 to 0.28 stars. 25% to 40% of contracts lose half a star. Over 100 contracts will fall below 3.5 or 4 stars, where bonus revenue lives. Between 1.3 and 2.2 billion could be lost in quality bonus. Overall, there will be at least a 1.4% loss of revenue on average for MA Part D plans. The lower star ratings impacts plans of all sizes, top 10, large, mid-size, and small. Let's look at a few other portions financially of the advance notice. Benchmarks remain 95% to 115% of fee-for-service. The coding intensity or pattern adjustment remains at negative 5.9%. Rebates remain unchanged by star level. Star bonuses stay at 5% for those 4-star and above. Part D risk corridors remain intact. CMS also proposes a Part D risk adjustment update to reflect IRA changes, including higher manufacturer discounts, separate calibration for MAPDs and PDPs, excluding audio-only and unlinked chart diagnoses. But we actually have heard a bigger signal before the advance notice, and it bears some discussion here. CMS wants to move risk adjustment toward MA encounter data and away from fee-for-service claims costs. If that happens, it breaks the historical link between MA rates and very high fee-for-service cost trends. That's a fundamental shift. What could actually change between now and the final announcement in April? Let's be clear, this advance notice is very disappointing for Medicare Advantage plans, but historically, the story doesn't always end here. As more fee-for-service claims data comes in, we should see some upward pressure on the effective growth rate. Utilization remains high, and that eventually shows up in the math, depending, of course, on the time frame CMS ultimately uses. We've seen this movie before. Last year, the EGR increased by 2.83 percentage points between the advance notice and the final announcement. If something similar happens for 2027, that would push the industry to roughly a 2.9% overall increase. Now, let's not kid ourselves. Even at 2.9%, that's still paltry in a high utilization environment, and it's well below the 5.06% increase plans saw in 2026. Could the administration offer some relief on risk adjustment? Possibly. It could phase in parts of the proposals. It could soften the blow. It could even abandon one of the changes. But if I'm a plan CFO listening to all this, I would not count on it. CMS is sending a very deliberate signal here, and April may adjust the numbers, but it's unlikely to change the direction. With that, we're going to take our final break, and when we come back, we'll talk about what this means for MA plans on the ground and the one real silver lining. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this edition of the Healthcare Labyrinth Podcast. Let's wrap this up. Let's go on to segment 4, the impact and the pivot ahead. MA plans are facing a perfect financial storm right now. Flat rates, risk adjustment compression, harder stars, elevated utilization, IRA-driven drug costs, more regulation, less flexibility. Plans use 2024, 25, and 26 to stabilize, but 2027 likely means another round of product tightening, benefit reductions, geographic contraction, and complications toward recovery. For years, strong margins were supported by coding intensity and risk adjustment arbitrage and easy-to-hit stars. CMS is now making something clear. That era is over. The future of Medicare Advantage is real clinical quality, real care management, real medical cost control. Here's the silver lining, though. A recent CMS analysis applying V28 to 2022 data suggests true MA coding differences may be closer to 1.5% to 2% now that this new V28 risk model is in, not the inflated figures we hear from the critics so often. AI, better documentation, and updated model years are narrowing that gap even further. The industry needs to make sure Congress understands that timing before outdated data drives aggressive overpayment policies. Final takeaways. The 2027 advance notice isn't just about rates. It's about what CMS wants Medicare Advantage to become. Plans that pivot to real value will survive. Those that don't, won't. I'm Marc Ryan. This is the Healthcare Labyrinth Podcast. Thanks for listening, and we'll see you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.